Hello, Gold participants and listeners from around the world. I'm Kristin Schwarz, licensed midwife and MC for Gold Learning. And here at Gold, our preparations for the upcoming Gold Midwifery Online Conference of 2020 are already in full swing. And before the conference, what we like to do here at Gold is get together with our speakers and chat a bit with them about the upcoming presentation, but also a little bit about their work in the field and what they're up to. And today, I have my special guest here with me, is Cora Beitel. Welcome, Cora.
Thank you. I'm glad to be here.
It is lovely to have you here. And Cora, you are a midwife, right? You are in the Vancouver area. So tell us a little bit about yourself, your practice, and what's going on in your life.
I am one of the founding midwives of the Strathcona Midwifery Collective in Vancouver, and we have been a practice that's been running in the downtown east side of Vancouver for just over 8 years. We currently have three teams of midwives who are busy caring for families around Vancouver and the surrounding areas. Yeah, and we run some different community events out of our clinic space as well. We really try to have a space that's a community gathering space as well as a clinical space.
Beautiful. So let me ask you this: are these all home birth, or is it a birth center?
Right. So in Vancouver, midwives work out of clinics where we see our clients during their pregnancy and for 6 weeks postpartum. For the
Mhm.
birth, people choose to birth either at home or in the hospital. So in Vancouver, our practice, we work out of two different hospitals as well as provide home births. So clients have a choice of where they want to birth.
That is wonderful. You, in your area, that is fantastic that you also have hospital privileges here in Florida, where I practice. Unfortunately, midwives don't have that. So we have home birth and hospital birth. So it's always wonderful to chat with professionals from other areas and other countries to see how they work and the services they provide for their families there.
Yeah, we consider ourselves really lucky to be fully integrated into the healthcare system in BC. And even within our educational systems, the midwifery program is part of the Department of Family Practice at UBC. And so, right from the get-go, midwives are learning alongside their physician colleagues as well as their nursing colleagues. And it makes for a really well integrated system where once we're working in the hospitals together, it's not two separate systems. It's really part of like a more of like a holistic healthcare team.
That is wonderful. That sounds like the best of both worlds to me, actually.
Yeah, no, we're really pleased to be working in that kind of system.
So when you have a transfer, let's say a hospital, sorry, a home birth, decides you need to transfer the client to the hospital, it should be rather seamless, right? Because you can just go in then and facilitate the birth then at the clinic.
Yeah, so when someone is planning to birth at home, we also register them at their chosen hospital and send their records there during the pregnancy. When the labor starts and we're with someone at home, we then
Mhm.
call that hospital and let them know that we have that person with a home birth in progress. And so the hospital then has that client on their radar. And then after the birth is successfully happens at home, we then call the hospital and let them know we've had a baby, everything's
Mhm.
fine, there's no concerns. They congratulate us, and then they close that file. But in the event that we need to transfer in, we call the hospital and we let them know that client I let you know about earlier. Now we're needing to come in maybe for an epidural or for an augmentive labor or in an urgent situation if we're hearing decelerations or there's meconium in the
Right.
fluid, whatever the reason is, we let them know why we're coming in. And certainly if it's an urgent transfer, do we need anything ready right away on arrival? And so then um, if it's urgent, they let the obstetrician know and they're waiting for us. If it's just coming in for an epidural, then we just come on in and admit the client at that point. And so it's really quite seamless. I mean, it's the hospital staff that we work with every day when we're having hospital births. And so when we're coming in from a home birth, we're not an unknown entity. They know us, they trust the care that we're providing, and they're just ready to welcome us into the hospital with what it is that we're needing. And so I do agree it is really quite seamless in terms of
Mhm.
transferring from home to hospital, if there's a need to do so, whether it's a routine transfer or an urgent one.
Wonderful. Yeah, that's it's great to hear how the countries operate. It's wonderful, and we can all learn from each other. It's I'm always interested in finding out more. Now,
Absolutely.
let's talk about your topic here. So you will be presenting at the Gold Online Midwifery Conference of 2020. Your topic is inclusive midwifery care, and not everyone who gets pregnant is a woman, right? So birthing and parenting is also extending to transgender people, non-binary people. So tell us a little bit about your topic and your practice as well, with that regard. And I have to say, I love your topic when you say they're providing safe, respectful, and celebratory care. I just, that really spoke to me, and I can't wait to find out more. So tell us a little bit about what you'll be presenting on.
Absolutely. So, in Vancouver, we've been running our practice for 8 years, and it was pretty soon at the beginning of providing care through the Strathcona Midwifery Collective that we cared for our first family where the person who was pregnant was a transgender man. And it it became really clear very on in that person's care that we needed to work quite significantly, not just providing safe care within the context of our clinic, but also making sure that we were working as advocates within the community, whether the person needed to go for an ultrasound or needed to go and access a clinic at the hospital, that there was still at that point a lot of education work that needed to happen.
Mm,
And so we weren't just providing the clinical care within the context at our clinic, but also really making sure that we were trying to pave the way for the safest care for them as possible within the larger healthcare networks. And then as we started caring for more and more trans clients, it also became really clear that there wasn't a lot of community resources available for
mm,
people. So in terms of prenatal classes or parenting groups, that there were definitely groups that were geared towards sort of LGBT families, but they were predominantly attended by sort of same-sex two-mom families, and that trans clients weren't necessarily feeling seen or welcomed in those groups. And then certainly when they went to groups that were predominantly for straight families, again, they were also not feeling particularly welcomed into those groups and felt a little bit out of place in a lot of different spaces that were available to families. And so we started thinking much more broadly outside of just providing the safe clinical care, but also saying what could we do in terms
mhm,
of providing more resources in the community. And so that's when we started the Trans and Queer Pregnancy and Parenting Group, which kind of runs throughout the fall to the spring, and it's been a facilitated group that we've had guest speakers come in to speak on specific topics, and then other groups where it's really just the participants who come that day who set the tone for what it is that they're
mhm,
hoping to talk about. And we have had movie nights and picnics in the summer, and so that's been a really lovely way to just bridge the gap between the clinical care and the community resources and the community building that has been really necessary. And so through doing the community care, certainly our clinic has become seen as a really safe space for trans, non-binary, and two-spirit clients to come to access care. And so we've certainly been caring for a lot of queer, trans, and non-binary families, and through that just been learning more and more as people's needs sort of change over time, and the community has sort of become more receptive through education that has been happening in the hospitals and the different community centers. A lot of people have been working on that, and so we've really seen that it's trans care is becoming more integrated into routine prenatal care, but that there's obviously still a lot of work to
mhm,
be done. But it definitely feels quite different now than it did, you know, 7 or 8 years ago. So that's really uplifting to see that
mhm.
change happen. But yeah, we're really excited to keep providing just that safe and respectful care. And I think what you highlighted in terms of the celebratory is really important to us and to the clients, because I think that sometimes we kind of stop short at just like safe care, respectful care, but that, you know, trans, non-binary, two-spirit families, it's important to feel like they're not just, and I mean, at bare minimum being tolerated or just,
Right.
respectful care, just like everybody else gets. There can be sort of a story of like, well, I treat all of my clients the same, but but I think that that sameness can overlook that certain people, certain communities need specific care. And so I think that it can be that celebratory piece really comes from feeling really seen, feeling like we don't all need to be the same. And I think that, highlighting our differences and having care providers who can specifically focus on caring for people in a celebratory way about those differences can be really meaningful, and that um, we don't all need to receive the same care and we don't all need the same care. And so I think that actually care that celebrates our differences to me is much more relevant than just saying everybody requires the same kind of respectful care.
Absolutely. It sounds wonderful. And I must say, congratulations to the great work you're doing with creating the community there and the community center and having these classes and programs. Sounds wonderful. And you're right, there wasn't, and even nowadays here, if I look at Florida, there isn't much resources available. So I am looking forward to the presentation because I feel like I can definitely learn a lot. And before I let you go here, before we come to an end, I do have one more question for you, though. What would you hope care providers would do better? You said things have changed, but what just quickly, is there anything you would hope that could be done better by care providers right now?
Mhm. I think that slowing down and asking people what they need from their
Mm,
care. And
mm,
I think that because there can be an assumption that I know how to provide care to my clients and I know what they need and I know how
uh-huh,
to provide that kind of safe and respectful care to people. But I think understanding that different people that can look really differently, and that and then if you slow down and ask people just really simply like, what can I do to best care for you and your family during your pregnancy, um, makes a really big difference, and you'll hear answers that you wouldn't hear if you didn't ask
mm.
that question. And so I think starting your care or at different points along the way, just pausing and just not assuming that you know what people need, I think can be really meaningful.
Very good suggestion. Well, thank you so much, Cora Beitel, for speaking here with me today and chatting a little bit about all the wonderful things you are doing out there and about the upcoming presentation.
It's my pleasure. Thank you.
And this presentation, Inclusive Midwifery Care, providing safe, respectful, and celebratory care to our trans and non-binary families, is, as I mentioned, part of the Gold Midwifery Online Conference of 2020. And Cora will be presenting live on February 10th. So check your calendar and check online when this will be for you. You can find out by visiting our website, goldmidwifery.com. There you'll find information on this presentation and all the other presentations in the conference. And we hope to see you there. Bye bye for now.